Hi, I just want to do a brief video orientation to the class, answer some questions up front so that when we meet Tuesday, you will be able to ask better questions, questions that I haven't thought of possibly. I'm going to click through the Blackboard course and talk about some key things that sometimes cause some questions. And the first thing I want to point out is the syllabus. In the syllabus, if you scroll through it, you'll notice that the grading plan, medication quiz, you've all taken. This evidence-based in-service. We're going to talk about that in greater detail a little bit later. There are journals this semester, and again, we're going to talk about those in a little greater detail. You'll be doing one care plan, and it's going to be an oral care plan based off of a concept map. And I have a lot of good resources for you to understand what you'll be doing there. And then you have simulations. You've already completed the OB simulation. You still have 2 days worth of med-surg simulations, and we'll talk about those. And of course, the clinical evaluation grid. The grading scale is like everything else. We do not round up anymore. So to get an A, you need 92.0. So let's talk about that weekly grid. The weekly grid is no different than what you've been doing for third semester. In advanced clinical, it's now a 5-week clinical, 3 days a week, and I want you to grade yourself for each day. Now, if you believe that you had a category 4 day, all 3 days, feel free to put 1-4. However, if you feel that one day you had a 5, say the second day, then I want you to grade yourself 4-5-4. Then, underneath that numerical score, I want you to put an asterisk in any of the criteria that you feel you've earned that 5 in. So I know what you're grading yourself on that way. For any scores that are not a 4, a 2 or a 5, you need to talk about those scores at the bottom underneath student comments for whichever week we're talking about. If you gave yourself a 2, this is where you're going to tell me what happened and how you're going to prevent it from happening again. If you think you've earned a 5, this is where you're going to explain what you've done to deserve a 5. Every year people ask me, well, what do you need to do to earn a 5? And I don't have an answer. It's difficult to give concrete examples of 5s. I'll tell you what isn't a 5. Showing up every week on time in a clean uniform. I have students that try to give themselves 5s for that. That's not a 5. That's the minimum expectation. I've had students give themselves a 5 because they turned their work in on time and they were polite to the patients. Again, those are the expectations. What would be a 5? Here's one concrete example, and about the only concrete example I can ever come up with on any given time. If you catch a med error that happened on a previous shift, if you notice it, you address it, you fix it, you take care of all that, that's a 5. Okay? It does happen. Now, if you gave yourself all 4s, you do not have to justify a 4. I still want you to give me a brief synopsis of the high points and low points of the week. You can get a 4 and still have a low point, okay? So I want you to still talk to me about what happened. You do not have to give me a day-by-day, patient-by-patient, step-by-step diary of your day. Give me a summary. So you'll be doing that every week. Whether you're in on the 5th floor in med-surg or whether you're in the emergency department or women's health, you'll be doing those every week. Something new for you this semester is journaling. We're going to be journaling every week. Now, what is a journal? Well, journal has 4 questions, and these are all in Blackboard. You'll do your weekly grid and the journals in Blackboard, not on paper. These journals look at professional behaviors. They want to look at clinical decision making, prioritizing, organizing, and managing care. This is always a challenge for students. Leading a patient team. And communication, another area that students can sometimes struggle. You will be working with doctors on the phone and even more often face to face. You may not have ever worked with a doctor face to face. You will in this clinical. I'll make sure of it. So those are usually journal topics that generate a lot of discussion, a lot of self-analysis. There are specific questions that you must answer for each of these categories. I want you to really dig deep and really look at yourself. We can talk a little bit more when we come face to face. It's something easier to do that. But journaling, it will be something new for you for this. Now you'll be turning both your clinical grid and your journal in the Dropbox for the week that you're doing that clinical. I'll grade it, get it back to you before the start of the next week. Now, the assignment is now the rotation calendar is now posted underneath calendars in the category information. And the rotation calendar, the schedule, is very specific. Tuesday is strictly orientation. When you show up Tuesday morning, we're going to get together for about a half hour talk, get to know each other a little bit, have about 3 hours for computer training, break for lunch, and then we're going to do some more get to know each other and get to know the hospital until about 2 o'clock, where I will pair you off with one of the nurses on 5th floor, and you will watch how the PM shift starts. You will tag along as they do their shift report, and you'll start doing assessments and watching the nurses pass meds. That's the first day. The second day, we're going to show up for pre-conference. Pre-conference is at 11:30, and we'll spend an hour kind of getting ourselves ready for the day, answering a lot of the questions that you will probably generate when you watch the staff. Now 3 of you will then go to your specialty units. OB, ER, and CCU are our specialty units this semester. Now women's health is kind of a special case. And the first day let me explain why it's special. Those hours can vary based on patients in the women's health. Many times I'll have students come in and work their shift from 7 in the morning to 4:15. Other students would rather go in the afternoon with the regular shift. I don't care which one you do as long as you tell me which one you're going to do, so I can make sure the staff in women's health know that. Now I encourage you to do the morning shift because they do inductions in the morning. They'll do scheduled C-sections in the morning. They'll do circumcisions in the morning, and they'll do discharges. So those are times when you can get a lot of stuff done. However, it might be when you're there on, let's say you're there on your schedule for Wednesday and Thursday. Wednesday morning you go in the morning and you find out that they have a lady who's scheduled to come in tomorrow afternoon, and the staff says you'll have better luck seeing a birth if you come in the afternoon. That's why this is kind of a flexible. This flexes based on what's available. Now I'll be honest, Holy Family does not deliver a lot of babies. I never get a semester where every student observes a birth. Usually about half the class gets a birth and the other half don't. If there is no birth going on, the staff up there is very good at teaching you and giving in-services to you and running through practice scenarios with you, so your time will be well spent. But when you're an OB, I also encourage you to bring your CHA book or any other textbook that you might have, because you may have some time where nothing is happening, and then that'd be a great time to maybe read part of a chapter or do some assignments. Now if you're in the ED or CCU, I'll take you down there. I'll introduce you to the staff, and you will spend those hours working in those departments. Now again, it depends on how many patients they have. The ED is variable. Some days are very busy, some days are not at all. But the staff is very good about pulling you in and getting you involved. But you have to be assertive too, Don't just stand by silent, waiting for them to take you by the hand and bring you in the room. Follow them into the room. If the nurse doesn't want you there or the doctor doesn't want you there, and usually the doctors will, but if somebody doesn't want you there, they'll tell you. Otherwise, just go in and tell the nurses when you're there, hey, I can do this. I can do IV starts. I can do NG placements. I can do IV push. I can do all those things. Depending on the severity of the patient, they may let you do that. Although if the patient is very, very sick, they won't, because time is important. In CCU, the staff there loves to teach, and you will learn so much in CCU, even if you have just one patient down there. They will have you doing as much as possible, and they will show you as much as they can. The staff down there absolutely loves students. So on Tuesday and Wednesday, the first week, Jody, Anna, and Carol, you will be off the floor in your specialty units. That leaves Jessica, Serena, and Courtney on 5th floor with me. That means just the three of you and me on our first week. You will get very good skills in those 2 days because I will be with you a lot. I don't have to take care of everybody. I have just 3. The following week, it's kind of flipped. Jody, Anna, and Carol will be on 5th floor. Jessica, Serena, and Courtney will be in the specialty units. Again, allowing me focused time with people when I only have 3 patients. So that's going to work out really good. So go ahead and go to the information tab in Blackboard and take a look at the assignment grid. All right. I'm going to try to keep this video to 20 minutes. We're at the 11-minute mark right now. Now, you've already done your OB sims. We do have med-surg sims coming up. Let's talk about that in person, say Wednesday or Thursday this week at pre-conference, okay? I'd rather just talk about that because I can answer questions a little bit easier. The evidence-based practice, the evidence-based presentation is an in-service. And there's 6 of you, so I'm going to break you into 2 groups of 3. And I want you to come up with an evidence-based practice question. And again, if you go to Learning in Blackboard, Learning Plan 4, Evidence-Based Presentation, it shows you what you need to do. It gives you the rubric and all the expectations. Be creative. Be very creative. Don't just write something up and read it to us, because do you like that when I read to you? No. So find some way of passing the information in a creative, exciting, interactive way, and you'll get really good scores then. Underneath the learning plans and Learning Plan 5, that is the meat and potatoes of this entire rotation. This is where you'll find your journals, the weekly evaluation and journal drop boxes. And please, in the week one drop box, put both the grid and the week 1 journal in. And then week 2, put both in. Don't separate them. It makes it harder to grade. Okay? So there's also information on the care plan. Now, when you go to the care plan resources and assignment drop box, click on that. And the first click is just it gives you another option going to curriculum resources. Go to the curriculum resources, and there's an audio video, or there's a video on how to do a concept map. There's an example, and then there's templates for the rubric and the concept map, as well as the Dropbox. You need to give me your concept map in the digital format in the Dropbox. If you want to bring one printed out to your presentation, because you will be presenting this to the entire class, I would encourage that. But again, this is something that's really good to talk about face to face, because you can ask me questions. The verbal care plans are really good because I give you immediate feedback. While you're giving your presentation, I'm grading you. And then after we're done, I have everybody leave the room and I talk to you on the spot. I tell you your grade right then and there. No waiting for anything. So this is really nice for everybody involved. Now, let me just pull up one more thing here for myself. Orientation, we've kind of talked about that a little bit, what we're going to do Tuesday. Feel free to bring in coffee, soda, whatever you need, because we are allowed to bring that into the computer training room. You can pack a lunch, bring a lunch in, or you can buy a lunch in the cafeteria. They have a very good cafeteria. I usually pack my own. It's up to you. And wear your uniforms. Be ready to go. Bring your stethoscopes. A lot of times when you're following those nurses, when you follow the nurses, don't just stand back silent. If they're turning a patient, if they need to listen to lungs, or offer to help. If they need to help person up to the commode, offer to help. The staff up there, the PM shift nurses, are relatively new. I mean, a lot of them have only been working there for 6 months or a year. They're young. They remember what it's like to be a student, and they will help you a lot. You'll be working with these nurses a lot. I want that. I want you to start partnering up with the staff up there, because then they know what you can do. You learn from them, and everybody gets better. And if you make a really good impression on the staff, Holy Family always has openings. When you apply, they remember you. Patient assignments. The first day on Wednesday, if you're up on 5th floor with me, you're going to have 1 patient. Now, I know you took care of 2 in intermediate clinical, but I've never seen you work. 1 patient. On Thursday, you'll get 2. Excuse me. As soon as I feel that you're ready, you'll get 3 patients. Holy Family generally is a very busy hospital. Almost always everybody gets 3 patients every day. Now, you might not get the same 3 patients all 3 days of the week. Discharges happen. So if you have 3 on the first 2 days, on the second day, one of them gets discharged, I'm going to grab another one, and you're going to have to learn to take care of a new one. That's real life. This clinical is meant to get you going toward real life. For preclinical prep, you have 75 minutes, an hour and 15 minutes to prep up to 3 patients. That means you need to prioritize what you learn. You do not have the luxury of looking at every lab they've ever had, of every nurse's note that a nurse has ever written. You don't have the time. You have to learn what's important. What's important? You'll find out probably after your first day of taking care of patients what you didn't need and should have gotten, and how much you got too much. But you'll eventually have 3 patients, and you'll do fine with that. In Holy Family, if you haven't been to Holy Family, there is no med room. Well, there is a med room, but that's mostly for narcotics and some very special PRNs. Scheduled medications are in the patient's room, as well as some PRNs like Tylenol is going to be in their room for them. So a lot of medications are available in the room. I have a key to the drawers. I only have 1 key. Keeps me kind of busy going back and forth between all of you, but that's okay. It works. You'll be doing a lot of IV piggybacks. If you are not comfortable with IV piggybacks, go to the skills lab, practice. You'll be doing a lot of IV piggybacks. We work with TPN, we work with piggybacks, we work with blood, all that. And I look for those patients. I want to give you those experiences. You'll be doing IV push meds. You will not be doing very many IM injections at all unless you give a flu shot. You're doing a lot of sub-Q, a lot of Lovenox, and of course, insulin. If you miss 1 day of the week, you will receive a 2 for that day, and I will actually count that as a 2 for the week. If you miss 2 days in a week, that's a 0 for the week. We're only in clinical for 15 days. You really do not have time to miss anything. So do the best you can to make it to work. Now, it's winter. What happens if you're snowed in? Call me. I'll give you my cell number. If you're snowed in, if you go in the snow in a ditch or something, call me. It won't mitigate that too, but I will make a note of explanation. Okay? If we have a cancellation, it's a cancellation. We're fine. Unfortunately, if it gets snowing bad in the like noon, they usually don't cancel until 4 o'clock in the afternoon, which is kind of miserable for us because we're already on the site. So we'll kind of see how that goes. And there's supposed to be some snow between Tuesday and Wednesday, so we'll see what happens. I drive down from Green Bay, and if I'm snowed in, we'll have to cancel clinical, because if I can't make it there, I can't make it there. It's never happened yet, but Never know. If you're sick, if you have a cough, I'm going to make you wear a mask. If you have sniffles, a mask. If you have a fever over 101, you're staying home. If you have projectile vomiting or profuse diarrhea, you're staying home. But those are the only reason to stay home. Headache? No, you're coming in. Okay? Because you'd have to do that on the job. Okay, we're just over 20 minutes. I'm almost done talking. All of your resources are in Blackboard. If for some reason something doesn't work, email me. I'll do what I can to fix it. I do the grades as soon as possible. I get them in Blackboard back. I will be looking at everybody's math tests to make sure that they were scored correctly. Sometimes if a person puts a comma in instead of a period, they're going to score it wrong. I do make those kind of corrections. So that is a very high-level view of what we're going to be doing for these 5 weeks. You're going to be busy. Again, you'll have 3 patients. You'll not have 3 critical patients, but you'll still have 3 patients. And unfortunately, sometimes I've given patients where they're all relatively minor and 1 or 2 of them suddenly get very sick. That happens. Work with me, work with your nurse. This is a very fluid process. Communication is critical. Again, I'll give you my cell phone number. When we're at clinical and you need me, text me. Now, they are not supposed to use their phones on the floor. That's a rule. But nobody's ever said anything when my students text me. So if you need me to pass meds or you have to do a dressing change or whatever, text me. I'll either say I'll be right there or I'll tell you when I can be there. Oh, dressing changes. PICC line dressing changes. We do a lot of PICC lines. So be comfortable with that too. All right, I know that you're going to have a lot of questions. I expect that. So write them out. Write them down. Bring them Tuesday morning. Tuesday morning and Tuesday during lunch and after lunch, we will answer all of your questions. I want this to be an exciting, fast clinical. I know you're going to be nervous, but you're going to get good. You've made it through 3rd semester. If you can make it through 3rd semester, you're going to do 4th semester. Okay? It's a little bit harder. We're going to work together. I'm going to teach you. I'm going to be there to support you. I'll make corrections if I have to. There are 3 things that I always want you to keep in mind. 3 things. 3 things. And if you remember these 3 things, chances are you're going to do really good. What are the 3 things? Infection control. Wash your hands walking in, wash your hands walking out. When we go into a patient's room, I'm going to tell you this right now. When we go into a patient's room, you will lead me in. I will come behind you. If you do not use the alcohol dispenser as you walk in, I will stand there having alcohol squirt in my hand until you notice it. That's 1 warning, okay? No penalties there. If it happens again, it's a 2, okay? I'm telling you that up front. That's number 1, infection control. Gown up when you're supposed to. Use the alcohol wash. Walking in, walking out. I don't care if your hand is still wet from the previous room. Do it again. Your patient doesn't know that you were just washing your hands. The patients know if you don't wash. That's 1. What's 2? Safety. Safety. Keep the patient safe. Keep you safe. Keep me safe. What's the biggest risk? Needles. If I see you take the cap off your needle, and then when you're done giving that Lovenox, you put the cap back on, that's an automatic 2 right there. Because you know you're not supposed to do that. Now they do have a safety at Holy Family on the needles. And tomorrow, Tuesday, I'll have some needles. We're going to practice using that safety so that I know that you know how to safe a needle. But having said that, every semester, 1 person does it. I don't know why, but 1 person will do it. I don't know who it's going to be, but we'll figure it out. But I'll just let you know, if I see it, I'll tap you on the shoulder or whatever, but it's an automatic 2, no ifs, ands, or buts, because that is a huge safety risk. Anything else wrong with needles? If you set them down, or those are problems. Other safety things: side rails, gait belts, walkers as needed, things of that nature. It's all common sense, nothing that you've never been told before. 3rd thing, dignity and respect. treat your patients with dignity and respect, the staff and me and doctors, and by now you should be doing that, but I want to make sure, this is really important. Patients remember their care. They remember the nurses exclusively because we're there a lot. And they'll remember you because you're a student. You'll have more time to spend with those patients. So use it wisely. Make them feel cared for. Make them feel important. Personally, I like to hear students say Mr. or Mrs., but if the patient says, call me John, fine, then go ahead. But dignity and respect go a long way. If you do those three things, chances are everything else is going to go fine. All right? That's it for this brief, relatively brief, 25 plus minute. My old orientation was 90 minutes. I kind of cut it down. All right. I'll see you Tuesday morning. Can't wait to meet all of you. I know a couple of you. I'm looking forward to meet everybody else. I've never worked with any of you in clinical, and you've never worked with me. So it is going to be getting to know each other on Tuesday. Have a good week. We'll talk to you later.